Let's talk about hyperkalemia. Hyperkalemia simply means increased or elevated potassium level in the blood. That's just a medical word. Okay? So, for nursing students, it is very, very important that you know how to take care of a patient with hyperkalemia because it's a very yield and clear questions. So, let's go. First of all, patient with hyperkalemia must be placed on cardiac monitor. And you have to know the normal potassium level, which is 3.5 to 5. 3.5 to 5. That's the normal potassium level. So if potassium level is 6.2, that patient must be on cardiac monitor. And when they're on cardiac monitor, we have to make sure we monitor the ECG. The ECG, you may expect to see elevated ST level or widened QRS. So what's the best medication to give? Because this patient will be having arrhythmias. The sinus reading will no longer be normal sinus reading. So we have to make sure that we know the right medication for our NCLEX exam, or even if we are working as a nurse, new grad. So the medication of choice is what? Calcium gluconate. Calcium gluconate is the medication of choice. But remember, calcium gluconate does not shift potassium back into the cells. No. What it does is to protect the heart because of the arrhythmias. Then the next thing we have to know is what are the medications that we have to give this patient. To shift potassium from the blood back into the cells, we have to give the medication called dextrose and regular insulin. Please remember, regular insulin is the only insulin you can give via IV. So when you give that medication, the dextrose and regular insulin used to drive potassium or shift potassium back into the cells, they just escape. So we have to move them back into the cells. Yes, the potassiums. We move them back into the cells where they're supposed to be. Then the next thing is that we may give K-Excellent. K-Excellent will help to track the potassiums that are in the GI, and patient will excrete it via bowel movement. Another question may be, how do you know that your K-Excellent is effective? You monitor bowel movement. Then you may also give that patient diuretics. Remember, we have loop diuretics and potassium sparing diuretics. Potassium sparing diuretics should not be given to patients that already have elevated potassium level. Example of it is spironolactone. It is potassium sparing diuretics. But the best one for a patient with hyperkalemia is the loop one, like furosemide. Thank you so much for watching.